Hey everyone, it's Dr. Namani and Dr. Louie back again today with the Athlete Spine, and we're really excited today to have two very distinguished and interesting guests on with us. It'll be the first time actually that we're having a doctor and patient and athlete combo on the show all together. So we have Dr. David Okonkwo, who is the team neurosurgeon for the Pittsburgh Steelers, as well as Ryan Shazier, who was, I guess, infamously injured in a game in 2017 and had a spinal injury, and Dr. Okonkwo was his treating physician. So thank you guys both for being on today with us.
No, thank you for having us.
Honor to be here.
Yeah, so this is a lot of fun for us. And I think the best way to get this started is, Ryan, I think a lot of people may know your story from a surface level, but I don't know, can you take us back to that day and sort of what you remember from the injury and what was going on during the game? And I mean, we'd love to hear a little bit about your journey overall.
Yeah, so I'm actually going to start about 2 years before that day, which is crazy because we were playing the Philadelphia Eagles in Philadelphia, and I remember one day I was in a training room, and I was getting my legs taped, and I seen Dr. Okonkwo in the training room, and I was like, man, basically I went to him like, who are you, right? Because back then the team doctors, the neurosurgeons, came to about one game a year, right, Dr.
Yeah.
They came to one game a year. So basically, I was like, man, who are you? He was like, just know you never want to see me during a game. And I was like, all right. Right. So I was like, all right, cool. But I after so often I'll see him and, I'll just talk to him. And then so on the day of December 4th, 2017, I was actually not supposed to play in that game because in the week before, I actually sprained my ankle on like the last play or the second to last play of us playing against Green Bay Packers. We already had won the game and, got into a pile and sprained my ankle. So literally that whole week, I didn't practice, like not one rep. I was obviously took the mental reps and things like that, but I didn't practice at all. And it was a game time decision. And me and Coach Tomlin and the staff just talked about it. And I was like, hey, I think I can get through it. So when the game started, man, as a linebacker, me and one of my good friends were saying, a linebacker, your goal is to try to get at least, 2 to 3 tackles per quarter. So my goal was like to get 3 to 4 tackles per quarter. Because if you get 3 tackles per quarter, you're gonna end the game with about 12 tackles. So that means that's a good game. So I started the first series off. This all happened on the first series. I started the first series off with 3 tackles. I'm like, oh, this is about to be a really good game. And I forget the guy name that I hit. I think his name's like Josh Malone. I don't remember exactly his name, but he was doing a drag route. He was in zone coverage, and my whole career, I never really thought about, hey, how do I tackle a guy? Hey, when somebody's running across the field, how are you supposed to tackle them? And this was the one instance in my whole life that I actually was like, hey, let me try to get my head across, and and I probably dipped my head a little bit too much and tried to get my head across. He was a little faster than I anticipated, and I hit him right in the hip. And it caused me to have, fracture my spinal cord. And then, man, that was a long, next 48 hours, man. It was because, you laid there on the field with a spinal cord injury. I don't know the last time I've seen anybody have a spinal cord injury, especially in the NFL.
Yeah.
And the only person I can think of that had one before me was Eric LeGrand, but in that situation, I wasn't thinking of Eric LeGrand. I thought it was more of a, man, I have a stinger, man, and the stinger is basically like, you feel like a numbness in your shoulder. So I thought it was more like a stinger or something that was very, not as serious as it was. So as they're, doing tests on me on the field, and then they take me back into the ambulance, Dr. O probably thought I was crazy because I couldn't feel my legs. I called my dad and I asked him to pray for me. But while I'm in the ambulance, I'm like, hey, Dr. O, I'm like, you think I'm gonna walk again? You think I'll be able to be ready by Christmas time? Like, I thought like, hey man, this is just something that I only will have for a little bit of time, and I will be able to heal from it pretty quickly. So I didn't. Then the next few days, it was, in Cincinnati's hospital. On the way to the hospital, when I actually got to the hospital, it was, to me, I felt like it was so many doctors and nurses in that one room that, I couldn't even see the wall. Dr. O might have seen something different than me, but in that moment, that's what I felt like I saw. And, then he came into the emergency room with me, and it was kind of cool to just see how they all respected him while he was there outside of his jurisdiction. So it was kind of cool. And then, Dr. O can kind of explain the rest, what was going on in the hospital side of things. But I just, I know that, I had like a blood clot when I was in Cincinnati. It kind of slowed things down. And, then I just had to, come back to Pittsburgh. I had surgery. After surgery, I still was kind of in denial because I'm a very optimistic person. I'm a very positive person. And everybody that knew me, they was like, hey, and everybody that was around me, we all had a very positive mindset. So like my family, they wouldn't let anybody come even talk to me or spend time with me if they weren't thinking, hey, Ryan's going to walk again. So when I was going through the whole process, I just kept saying I can do this. God has my back, and I'm gonna play football again. And that's kind of the mindset that I feel like you have to have when all the odds are against you, and God is good.
Yeah, no, absolutely. I know that's really scary, and what a journey you went through. So, I mean, right after the injury happened, what was it that you felt, right? You said sort of your legs felt different, that you couldn't move them as well. Did you know something was wrong right away? And what were you actually what did your legs feel like compared to your arms?
So basically, when I made the tackle, I had a slight burning sensation in my back. I wouldn't say like it was like super intense, but it was like a burning sensation in my back. And basically, my legs just, when I try to make the tackle, it's just like my legs just drop down. So if you watch the tackle, I kind of just dropped down to the floor. And then when I was laying on the floor, I could feel everything basically above basically from my belly button and above. And then pretty much everything underneath, I just couldn't move it at all. I didn't feel any, when they were trying to touch me down there, like trying to touch my legs or my hips or anything. I just didn't feel any emotion down there. I didn't feel any feeling from anybody when they were trying to touch me. And while I was laying on the field, it was a very scary moment just to not be able to move your limbs, because you learn how to walk when you're a kid, and you never expect you're not going to have to learn how to do that again. So it was a very scary moment for me.
And after your operation, how quickly did you regain some of that sensation and strength? And tell us a little bit about kind of the early, stages of your recovery, let's say the first month after your surgery.
So within the first month, I would say I definitely started to have major improvements. So I got hurt December 4th, December 17th, because that's my brother's birthday. So December 17th or December 16th, it was I think my brother's birthday is December 16th, my fault. December 17th, I started.
Hopefully he's not watching yet.
Yeah. We ended up playing the Baltimore Ravens. And I remember when I was at the doctor, I started to feel like I was starting to get motion, because obviously when you have surgery nowadays, they get you right into rehab so you can start doing things. And I was able to start to bend my left knee up and down. Like basically if you hold it, I just couldn't do it myself, but if you lift my leg up, I was able to do this with my leg. And that was the 17th of December. And I remember talking to that one of the other doctors that was there was basically saying, that was a lot of progress for how soon I got injured. And it was kind of like not. I mean, we didn't play the Ravens, we played the Patriots. I'm sorry about that. That was a good feeling for me, because I was able to go to the game. So it was like, hey, it was good news to the people that I know that wasn't going to tell everybody.
Mm-hmm.
So it was allowing me to just be happy with the little bit of improvement that I had, and then also show me that, hey, I am making improvements. And the one thing that me and my family, we decided to do, we always try to mark down, every little step that I made, and we just start calling those first downs. So every time I made any progress, we'll call it a first down. And then if I did something significant, it will be considered a touchdown. So like for me, that was considered obviously a touchdown. But from the next moments on, little things like moving my legs, little things like moving my toes, those were considered first downs. And then like when I took my first step initially, that'll be a touchdown. So we kind of like every single day, I was just trying to get more and more first downs. so I can be able to walk again.
I mean, when you have an injury like that and you're faced with such like a tremendous obstacle, right? It must have just been really, really good for your psyche to have like these little goals, these little baby steps that you're taking along the way for recovery. And if you think of all the thousands of people around the country that have spinal cord injuries, right? They can kind of look at this and kind of focus on that one step, literally and figuratively, I guess, ahead of them, to try to recover and come back from an injury like this.
Yeah. So one of the biggest things for me is, it's a Kobe Bryant saying, obviously, but I was kind of do it before he even said this publicly, is basically he said, if you get better every single day, imagine where you're going to be 5 years from now.
Yeah.
And that's kind of the approach that I try to take when I was going with my injury. Every single day, I was just trying to get a little bit better every single day, because I knew that I'm just not going to wake up and start walking unless Jesus came back and touched me. That means the world is ending. So, so basically, I knew that every single day I had to just take one step at a time and just, consider and just be thankful for the steps I was taking, and then just use a little motivation that everybody would give me, and just try to continue to move on. But yeah, you just have to go one day at a time. You're not going to just wake up and, everything's good.
Yeah, and I think one of the questions we'd love to wrap up with you and is that as an NFL athlete, right, you have such an amazing platform for so many different reasons. And, if we think about a blessing in disguise in terms of the injury, right, we wish the injury never happened, but unfortunately has, and you've had this recovery. One, is how are you doing now? But two, what do you tell other people who are looking up to you when they've had these types of injuries and they know about your injury in the past? What do you tell them, and how do you use your platform to really kind of motivate others who are going through something very similar?
So I'll definitely tell you how I use my platform. I remember when I first was injured, when I was kind of going through everything, I had a conversation with my dad, and everybody was like, Ryan, you inspire me, you inspire me, you inspire me. And then I had a conversation with my dad, and I was like, Dad, like, what does inspire mean? Because like obviously everybody can say you inspire me, but sometimes it's like when you're the inspiration, it's like, man, like that's a lot. That's a big, a lot on your shoulders sometimes, because it's like you got to continue to push forward to help other people push forward for themselves. So I remember when I asked my dad that question, and he was just like, Ryan, it's a blessing to be an inspiration, but it's also you have to continue to push forward, because you inspire people to, you motivate people, you push people to do more than they feel like they can do themselves. So what I do now is I have a foundation called the Ryan Shazier Fund, and it helps individuals with spinal cord injuries. And right now we're in the Pittsburgh region, and basically anything that's 2 hours outside of Pittsburgh, and we're also in Columbus, Ohio. So we're in northern West Virginia. We're in northern West Virginia, a little bit almost towards the center of PA, and we're in eastern Ohio. So
cool.
that's the way that I'm able to help individuals with spinal cord injuries. And then when I actually talk to somebody with a spinal cord injury, some of the things that I tell them is just, hey, you just have to push every single day. And one of the things I really think that helped me out a lot is I recorded all my sessions. So basically when I'm doing my rehab, a lot of people, they just go through their sessions and just constantly think they're plateauing. But if you actually be able to record what you're doing, it allows you to look back and like, hey, a month ago, you can barely lift your toe, but now you're actually lifting 3 or 4 toes, but you still feel like you're plateauing. So my family did a good job of recording all that information, recording all those videos, and it showed me how I was getting better, because I would say, hey, I'm not getting better today. Then they'll be like, hey, Ryan, look at you 2 months ago.
That's really great. It's almost like your game tape, right? You can go back and like see what you were like before, and then really track your progress. That's great.
Yeah, it helps out a lot. The biggest thing is you just got to make sure you're not recording other people if they're behind you.
Yeah. Well, Ryan, we want to be respectful of your time. Today, we're recording this on April 8th, and so we got a big game tonight, and I know you have plans to go watch that. So really just want to thank you for coming on tonight and telling us and everyone else about your injury and your progress and recovery. It's really been nothing short of remarkable what you've been able to achieve since this injury, after your recovery, and all the people that you've been able to inspire, with your foundation, and everything you've done for kind of the community of people, athletes, and lay people with spinal cord injuries. So thank you very much.
No, thank you guys for having me. This is truly a blessing to be able to tell my story. And then it's kind of cool to be able to be on a podcast with Dr. O. We talk a lot in general, but it's kind of cool, So I just want to say thank you. I appreciate all three of you guys for the impact that y'all make for individuals every single day. So I just want to say thank you for having me.
Great.
Awesome. All right,
I'll see you
Ryan,
later.
we'll see you later, okay?
You guys, see you, Dr. O.
See ya.
All right. Thanks.
All right. Well, we're going to transition here to talking to Dr. David Okonkwo. Again, he is the University of Pittsburgh neurosurgeon who took care of Ryan Shazier when he had his injury. You and I, the three of us actually have talked about this a fair bit previously, kind of what that day was like. But can you kind of go back to that day from your perspective, what that was like when he initially had his injury and what was going on through your mind at that time?
Yeah, as Ryan mentioned back then, I didn't go to many games. My predecessor, Joe Maroon, who was the team neurosurgeon for the Steelers for 38 years, served that role. And then occasionally he would have a conflict. And on December 4, 2017, he was overseas making a house call. And he asked me to travel to Cincinnati and be there in his place. And it was one of those things where perhaps that's how it was meant to be. I've spent my life, dedicated my life to taking care of patients with spine injuries and spinal cord injuries. And then for me to be there in that moment as the last player in the National Football League to sustain a spinal cord injury, to be there on the sideline, on the cart, in the ambulance, in the emergency room, in the ICU, then we brought him back to Pittsburgh for the surgery, and then to have walked this journey with him for more than 6 years to see how far he's come, it's a heavy burden, but it was, for me, similarly a blessing to be in that position where everything that I had learned from the hundreds and hundreds of patients I had taken care of prior to Ryan could be applied in that moment when it was clear that what we did for him was going to be judged, globally.
Yeah. So can you tell us a little bit about the injury that he sustained and sort of your thought process through the workup and then the eventual treatment? Because I know, he was in Cincinnati and you all decided to fly him back to Pittsburgh to eventually undergo his surgery. So, can you describe to sort of the audience sort of what exactly was the injury itself and what caused the spinal cord injury and why the delay in the operation?
Yeah. Ryan, who is perfectly comfortable with my sharing this story. We're not in violation of HIPAA or anything else. Ryan has given me his blessing to share what we went through. Ryan sustained an injury that had never been seen before in football. And Ryan has idiopathic scoliosis. And when you understand scoliosis, since that's my day job is correcting people with scoliosis, and my night job is taking care of people who get hurt. And my weekend job, idiopathic scoliosis has a very characteristic hallmark, which is hypoplasia of the pedicles on the concavity at the apex of the curve. And as you know, most idiopathic scoliosis involves a dextroscoliosis of the thoracic spine. And so the left-sided pedicle at the apex of the curve is a known weak spot biomechanically in the scoliotic spine, such that a tackle with the crown of the helmet, the force will exit the weakest part of the spine, which would classically be in the cervical spine. But in a patient or a player with idiopathic scoliosis, the weakest spot is the apex of the curve on the concavity. So he sustained a fracture of the pedicle at the apex and punched his spinal cord, I think also with a bit of a compression axial loading and exacerbation of that curvature, with the spinal cord sitting right up against that pedicle, hugging the concavity. And he punched his spinal cord. He was in Asia A, complete spinal cord injury on the field. If you look at the video from that night, we didn't put him in a cervical collar. We didn't do C-spine precautions because we knew from the physical exam this was not a cervical injury.
Mhm.
We get him to the University of Cincinnati's medical center and had the extreme fortune of phenomenal people there to guide this process. My good friend Joe Chang, who's the chair of neurosurgery at University of Cincinnati, just happened to be on call that night. Bill Knight was the intensivist in the neuro ICU who helped care for Ryan. He also is the same neurointensivist who cared for Damar Hamlin when Damar Hamlin suffered a cardiac arrest at the Buffalo Bill on Monday Night Football in Cincinnati, just like Ryan Shazier on Monday Night Football in
Yeah,
Cincinnati.
crazy coincidence.
And we made the diagnosis after the CT scan, but it was also very clear, as we very quickly followed that up with an MRI, that there wasn't active spinal cord compression. So we take him to the neuro ICU and went full bore. We used hypothermia. We used the Bracken protocol of high-dose methylprednisolone, which can be controversial. But if you think about what's the downside of steroids, it's the risk. But there is no real risk of high-dose steroids in a perfectly sculpted elite 25-year-old athlete.
Right. Yeah. Very different than what the studies, looked at. Right.
Right. So
Yeah.
he's not 75 years old with multiple major medical comorbidities. He's a perfect physical specimen at the prime of his life.
Mhm.
So we did high dose steroids. We did hypothermia. At that time we were doing MAP management with raising his blood pressures. And we were throwing the kitchen sink at this, but he didn't have active spinal cord compression.
And all of this is basically meant to reduce the secondary hit, right? That secondary result of inflammation and swelling that happens around the spinal cord that could result in further injury that sometimes is even worse than the initial trauma of what happened to the spinal cord.
Correct.
Yeah.
Over the next 24 hours, he started to show signs of recovery because he had extension in his great toe on one side. And it was the first indication, I mean, just the tiniest bit of extensor hallucis longus function. And you're thinking to yourself, my goodness, maybe we have a chance here to make a difference. At that point, we were making arrangements for him to transfer back to Pittsburgh the next day. And that was when I learned that Pittsburgh is within flying distance of Cincinnati by helicopter. So the great folks back at UPMC arranged for a helicopter to be sent to Cincinnati, which makes things radically easier logistically than having to do fixed wing out to the airport. You can just take the elevator up to the top of the hospital in Cincinnati, load it on to the helicopter and fly him to Pittsburgh. So we had already been setting that up for the next day, that we felt that hemodynamically we were in a good place and it was time to transfer. On post-injury day 2, he lost the neurologic function that he had recovered. Mm-hmm. And he went back to being an Asia A. And at that moment, the helicopter was already there. So we put him in the helicopter, flew into Pittsburgh, put him straight into an MRI. And that's when we discovered, as Ryan had hinted at, that he had in the interim developed an epidural hematoma that now was causing spinal cord compression that was not present on the first MRI.
Yeah.
And so we then went straight from MR to the operating room, and I did an operation that I've done for many other reasons, for many different, radically different purposes. But technically what we did was a transpedicular approach. So I drilled down that fractured pedicle at the apex of the concavity, evacuated the epidural hematoma, and then did a short segment fusion of the apex of his curve to address the fracture, but also to make sure that his spinal cord was no longer stuck up against that pedicle on the medial border of the canal with
Right.
additional pressure from an epidural hematoma. In the aftermath of that, we started doing additional things. We used omega-3 fatty acids, but we also used hyperbaric oxygen. And there's some really interesting data to suggest that hyperbaric oxygen can assist the injured spinal cord, but technically it's extraordinarily challenging to deliver hyperbaric oxygen. They're called dives when you take someone down to a hyperbaric oxygen chamber. And this isn't, the ones that you see in outpatient centers. This is the full bore, hospital-based hyperbaric oxygen chamber for diabetic wounds. That's the principal use of them. And Ryan also completed 29 dives, as they're called, in the hyperbaric oxygen chamber. It was made very clear to me that any resource that I felt was necessary to assist in his care would be made available to me.
Yeah, that's nice. That doesn't always happen.
But I'll tell you, the perhaps the largest victory of all in those things was that his stay as an inpatient on our world-renowned spinal cord rehabilitation unit at UPMC under the care of Dr. Amanda Harrington was several times longer than the typical spinal cord injury patient is afforded the luxury of staying in an inpatient spinal cord injury unit on the basis of current insurance guidelines.
Right.
And there's nothing that you can do that can discount what the value of that is.
Yeah.
Really, that entire experience, soup to nuts, and as Ryan and I've discussed many times, it was not lost on him that he was being granted care that wasn't available to the other people going through the exact same experience that he was all around him. And to his credit, he has pivoted his post-NFL, post-recovery life to this commitment to his foundation, where the goal is to identify people living with spinal cord injuries in Western Pennsylvania and near his Ohio State Buckeye home, where he played his college football, to fill the gaps of the things that you just don't get from insurance in modern times. And I'll give you a perfect example of that. A patient with a spinal cord injury with current insurance standards has to choose whether they want a manual wheelchair or an electric wheelchair, because you can't have both.
Oh,
and these can be very expensive. And as you can imagine, the electric being even more expensive than the manual. But the manual wheelchair affords significantly more independence because you can put it in the trunk of the car. You can, and your ability to travel and go places is significantly facilitated by a manual wheelchair. So if you choose the electric wheelchair as your one choice from insurance, you're consciously choosing to give up independence and life experiences if you can't afford what are expensive manual wheelchairs. So that's an example of something that someone can apply for a grant from the Ryan Shazier Fund for Spinal Rehabilitation.
That's awesome.
To cover the gaps of things that insurance companies don't do in modern America.
Yeah, it's really just kind of distressing to hear that. Yet, all three of us who have dealt with this for not only this sort of condition, but for many, many conditions, where some resources to provide for post-operative rehabilitation can make all the difference, and how someone recovers and how they can kind of return back to normal life. So it's really fantastic that he's been able to do this and provide so much hope and just resources, for people dealing with what's a terrible condition that just alters their life, permanently forever.
Right.
Yeah, and I appreciate you joining us today as well, Dr. Okonkwo, because I think that there's a stigma around spinal cord injuries, and it's not a good or bad one. It's just one that it's like a black box of sorts, right? I think there's just a poor understanding of the injury and the pathology itself. And like, how much goes into the actual decision making and when we're trying to treat a patient, and it's part of the art of medicine, but it's also just in times of urgency, we're forced to make decisions quickly with the resources and the information that we have. And this is one of those types of stories, and albeit on an awesome platform where people will hear it, that you're forced to utilize everything you have and the team around you to make decisions quickly that have consequences. You know,
I'll tell you a quick anecdote. He goes through the primary and secondary survey in the trauma bay, this room filled with the largest trauma team you've ever seen, right? Since everybody knew what was coming in, and I'm standing there in my Steelers garb, and and at first people are looking at me like, who is this guy? And then Joe Chang shows up a few minutes later, and then Ryan goes to the CT scanner to get the imaging, and so Joe and I are in the control room of the CT scanner, and we're waiting for the imaging to come up. And I looked at Joe and I said, Joe, every decision that you and I make for the next 24 hours will be scrutinized for the rest of our careers. So there's no pressure here, but we're going to get this exactly right.
Yeah. It's a nice person to have by your side, by the way, at least.
Yeah. Close colleague and friend to live live those decisions with, for 24 hours. So
certainly beneficial to have a trusted agent. And then I'll share one other thing about Ryan, which is that he had a smile on his face the whole time. He was never down. And from the very get-go, his approach was to ask, what do I got to do? And he said to me, listen, I've won everything I've ever tried in life. There's never been something that I've done on planet Earth that I haven't figured out how to win. So I just needed you to teach me the rules of this particular game, because I'm going to win this game too. And there was never the moments where he was despondent. It was always positive energy. And it was always, just tell me what I got to do next to get to the next level. And when his dad talks about inspiration, it's a remarkable thing when your patient is the one who's inspiring you to do a better job. And the fact that everyone around him wanted to do what it took for him because of the energy that he brought to the equation. And I think it's a real testament to Ryan's character and to his approach to life. And he was an inspiration to me as well. He remains.
Yeah, I mean, it truly is an amazing story, and I'm sure he continues to inspire many people, not only through his own personal actions, but also those that he does on behalf of his foundation as well. So it really is something that is incredible. As a other personal side, the reason why I got into spine surgery is my best friend from high school had a thoracic spine fracture. And he too was an ASIA A and unfortunately remained in ASIA A after surgery, meaning no motor or sensory. But since he had that injury, he went on, got a second bachelor's degree. He got a PhD. He's now the one of the lead guys running electronic warfare for the United States government. And,
wow.
He's actually been an inspiration to me, in just my own life. And that happened, over 20 years ago at this point, and so it is truly incredible what people that are faced with just these horrible life circumstances can go on to achieve, maybe because of it, right? Because they've had to deal with such adversity that they just go on to do bigger and better things afterwards.
Yeah, Ryan has told me that he's grateful for his injury.
Yeah. I mean, such an incredible story and what you both have gone through as well. And I think it's part of our responsibility is we've seen patients who have this really unique and driven mindset to recover is, how can we do our best in these times of uncertainty to encourage our patients and help them with this mindset of, we can do this, we're in this together, right? This is a team effort. You're never going to be on this island by yourself. But the mindset is so important in the recovery because we know more days than not, it sucks, right? And so it's part of our responsibility as part of the caretaking team to encourage our patients and remind them that, there are people who have done it, and recovery looks different for everyone, and establishing what a new normal looks like. And I'll thank you both.
Yeah,
for
and
joining us.
and whether the recovery is the picture of your friend, or whether it's the picture of Ryan, the blessings can be the same.
Absolutely.
Mm-hmm.
The value can be the same. The impact can be the same. And it's how the individual chooses to respond that will dictate the future outlook.
Right. Absolutely. Well, with that, I think we'll wrap it up. Dr. Okonkwo, thanks so much for joining us today. Be sure to like and subscribe and follow us on Instagram at The Athlete Spine. Thanks again.
You're welcome. Thank you both.